Hello and welcome everyone to my presentation on the use of humanities in health professions education. My name is Chi. I'm a third year medical student from UWA, and just a bit of a preface, I was unable to present with my group, so I'm doing my own presentation this week. So just a bit of introduction and structure in today's session. It's a small teaching group run over Zoom, and the participants include 8 UWA students, which will be divided into pairs to perform various activities throughout the session. There will be one tutor to lead the class, which is me, and I've also uploaded pre-class resources to LMS such as the learning outcomes, the session outline and structure, and I've also recommended a reading, which is the role of humanities in the medical curriculum, medical students' perspectives, because I believe like the majority of the class are medical students. So this session will be divided into 2 parts. Part 1 is a facilitated group discussion led by me, and we'll be covering the definition of medical humanities, examples of humanities in education, and the advantages and disadvantages of implementing humanities in the context of health professions education. Part 2 is a small group activity which should take around 3 minutes, and we're going to be discussing and analyzing 3 pieces of art, and we can see how studying these pieces of art can play a role in medical education, and they all have an underlying theme which is quite interesting. I'll show you guys that later. So the learning outcomes we'll be going through today is defining humanities and gaining understanding of the role in medical education, discussing examples of humanities and reflect on how the underlying themes relate to health professions, develop an appreciation for the advantages and disadvantages of humanities in the context of medical education, and discussing and demonstrating the best use of humanities in medical practice. The teaching methods I'll be implementing in today's sessions include reflective learning, active learning, student-led learning in buzz groups, and a formative assessment that's due by next tutorial. So part 1 is a facilitated group discussion led by the tutor. Let's begin this. So before we begin, just to make sure everyone is on the right page here, does anyone know the definition of medical humanities?
Yes, so my understanding of medical humanities, it's the interdisciplinary field of medicine which focuses on social sciences, arts, and humanities, and their relation to medical education and practice.
Yes, so that's a perfect definition there, Chi. I would say that humanities include philosophy, ethics, history, comparative literature, and religion. Social science can include psychology, sociology, and the arts is like literature, theatre, film, and visual arts. And most importantly, how they apply to medical education, which is what you said. So before we delve deeper into medical humanities, can anyone in this class share their experience with humanities in the course of your degree? Yes, for me, I've taken broadening units such as music, which has allowed me to explore my more creative side. You know, studying something other than anatomy and physiology all day and instead learning how to play the ukulele has reduced a lot of stress and improved my mood drastically. I've also done Aboriginal health, which has taught me a lot about Indigenous culture and ethics, and I found that it's also recently benefited me in clinical encounters with the Aboriginals. Yeah, thanks for your input there. So it's really great to see how humanities such as playing ukulele and learning about Aboriginal culture and ethics has really tied in with your medical education. So before we move on to the next slide, can anyone give me some advantages of studying humanities in the context of health profession education? Would it help with your mental health? Yeah, definitely. So let's get into it. The advantages of humanities and the role of medical education. So first of all, the medical humanities can assist medical practitioners with viewing issues from more than one perspective. For example, studying about other people's perspectives on medical ethics is different from one another due to different cultures, religions, societies, and traditions can explain complexity towards other people's viewpoints. Closer relationship with peers and patients, understanding and accepting different viewpoints through religious studies, philosophy, literature, etc. Increased creativity in thinking, as we're using more of the left side of our brain, it can really benefit how we tackle different issues. The mental health benefits is without question. Suicide rates among doctors is more than twice the general population, and studying arts can help to build resilience and increase communication. So in this model, we can see how the science and arts and humanities can be used together in correlation. They should never be seen as separate, but they should be seen in hand. So with science, when clinicians gain a scientific understanding, they can use their interpretation and insight along with studying ethics and educatedness, so things such as broadening their perspective and adaptability. Alongside this technical judgment and humane judgment from these humanities and science, they can gain the most optimum judgment in a clinical situation. So as you can see, broadening the scope of medicine is extremely important for future clinicians. And in this slide, we can see an example of how Stanford University is incorporating a summer program that runs for 2 weeks, and it's an art anatomy program in which they combine learning anatomy with arts, which is quite interesting. Yep, and again, Stanford University medical students are adding art, music and literature to their studies. So now that we've discussed the seemingly endless advantages of studying humanities alongside medical education, I think it's only fair if we discuss the possible disadvantages. So can you guys split up into pairs and take 2 minutes to discuss the possible disadvantages? So now that 2 minutes is over, what are some possible disadvantages of implementing humanities in medical education? Would someone like to volunteer? Yeah, I'm thinking maybe the use of resources could be allocated towards something else. Yeah, that's a definitely valid point. Let's get into it. So some of the disadvantages would be information overload. Learning about different cultures and ethics whilst also in medical school can be quite overwhelming and exhausting. So, you wouldn't really want to be learning how to play ukulele whilst you have a medical exam coming up, for example. The next disadvantage would be it's quite time consuming. So students' time can be spent furthering knowledge in clinical science and finishing their degree faster, as pointed out earlier. It can also be quite demoralizing. Playing a ukulele knowing you'll have no benefit towards the future and comparing it to learning anatomy, students can really start to think, why are we doing this? Is it worth the time and money? Just for the sake of completing an elective. So it's good to be aware of these disadvantages as well. So in part 2, which is a group activity, it's going to take about 3 minutes. I would like you guys to split up into your pairs and discuss 3 pieces of art and your relation to medical education. So would anyone like to volunteer their thoughts on the first piece of art we have here? Well, from my interpretation and understanding, I feel like the picture depicts an individual who's battling himself. He's showing feelings of despair, hopelessness and desperation. And the colors of black and white in this image further emphasize the feelings of anguish and unhappiness. Yeah, that's a great analysis of the art we have on the screen here. So I would like to point out that this piece of art is called At the Bottom of the Anxiety Swamp by Jae-yoon Choi. He says, there is a moment when you can't help but sink deep down, attacked by spiteful thoughts, but oh dear, I was the monster. So you guys can really see how that this piece of art really brings out some psychiatric conditions, and makes you more aware of how these people might be experiencing these thoughts. So would anyone like to interpret this image and give me their understanding of what it could mean and keep in mind the theme of mental health? From my interpretation, I feel like the author is trying to convey that the individual is having a multitude of harmful thoughts. As the image is colored in red, it creates a sense of torment and agony. Also, from the person's body language, his gaze is looking towards the floor, almost in a despondent and dejected manner. So this title of the art is called Mind Vomit, and it represents the daily conversation within my mind: anxious thoughts, depressive thoughts, sub-thoughts, thoughts about the thoughts, a constant critical commentary, and a tornado of darkness, numbness, and complete inner turmoil. So this image it's relatively simple compared to the previous two, but we'll go through it together just for the sake of time. Compared to the previous two, it has a bit of a double meaning, and by the individual saying "who cares," bipolar disorder can leave the patient with an elated, exuberant self-esteem one day and a depressed, meaningless sort of attitude the next. So by saying "who cares," it's a bit of like a double-edged sword, and people with bipolar disorder can sort of relate to this. So you guys can definitely see how studying arts and the emotions behind certain pieces can definitely help play a role in analyzing mental health. From my personal experience, this has allowed me to explore deeper complexity when studying psychiatric conditions, such as depression, anxiety, and bipolar disorder in this image. When you're in your next psychiatry placement, try to keep in mind these images and how it influences your perspectives. Yeah, so this is a picture by Janet Ford, "Who Cares?" and it's about bipolar disorder. So before we conclude this class, I'd like all of you to reflect on a clinical situation you've had with a patient where the use of humanities has benefited the encounter. For example, studying Aboriginal arts and culture and religion has really helped me with Indigenous patients. And this will be due for next week's tutorial, and we'll share it as a class together. And these are just the learning outcomes and the teaching methods used to achieve these outcomes. And references for your own reading in later time if you wish. Thank you.